Welcome back to the Score Builders Question and Answer podcast. This podcast provides members of the Score Builders team with the opportunity to explore challenging multiple-choice examination questions with students actively preparing for the licensing examination. Ready? Let's go. A physical therapist is educating a patient with lower extremity lymphedema on proper skin and nail care as part of their home management program. Which of the following instructions is most appropriate to include in this patient's education? Option 1. Soak the foot in hot water daily to soften the skin and improve circulation. Option 2. Cut toenails straight across and file any sharp edges to prevent skin trauma. Option 3. Use a pumice stone on areas of thickened skin to reduce buildup. Option 4. Apply a high pH lotion to the limb daily to keep the skin moisturized. Patients with lymphedema have a compromised lymphatic system that significantly increases their susceptibility to skin infections such as cellulitis. The skin acts as the body's primary barrier against bacteria and other pathogens, so any break in that barrier can lead to a serious and potentially life-threatening infection. Proper daily skin and nail care is a critical component of long-term lymphedema self-management. Before we look at the options, let's establish the overarching principle that governs every correct answer in lymphedema skincare education. Skin integrity is everything. In a patient with lymphedema, the lymphatic system is compromised. Fluid stagnates in the tissues, immune surveillance is reduced, and bacteria that enter through even a tiny break in the skin can rapidly proliferate and cause cellulitis, a serious, painful, and potentially life-threatening infection. Every recommendation in lymphedema skincare is designed to protect that barrier. Keep that principle in mind as we evaluate each option. Let's explore each of the options. Option 1. Soak the foot in hot water daily to soften the skin and improve circulation. This option sounds reasonable on the surface. Soaking softens the skin and feels therapeutic. But apply our guiding principle here. Heat causes vasodilation, which increases fluid flow into the tissues and can worsen swelling and congestion in a limb already struggling to drain properly. Beyond the fluid dynamics, prolonged soaking can also macerate the skin, softening it to the point where it becomes fragile and more susceptible to breakdown. Hot water exposure is a specific contraindication in lymphedema management, and patients should be counseled to avoid hot baths, saunas, hot tubs, and heating pads on the affected limb. Option 2. Cut toenails straight across and file any sharp edges to prevent skin trauma. This instruction is designed to protect skin integrity. Cutting nails straight across, rather than curved at the edges, prevents the nail from growing into the surrounding skin and creating an ingrown toenail, which is an open wound and a direct entry point for bacteria. Filing any remaining sharp edges eliminates the risk of the nail accidentally scratching or cutting the surrounding skin during daily activities. In a patient with lymphedema, these small, seemingly routine nail care habits take on significant clinical importance because any break in the skin, no matter how minor, carries an elevated risk of serious infection. Option 3. Use a pumice stone on areas of thickened skin to reduce buildup. The intent behind this option is understandable. Thickened skin, or hyperkeratosis, is a real finding in chronic lymphedema, and it can feel like it needs to be addressed. But the method matters enormously. A pumice stone is an abrasive tool, and abrasion creates micro-tears in the skin surface, microscopic breaks that are invisible to the naked eye but large enough for bacteria to enter. Patients with lymphedema should use gentle techniques for any skin maintenance to avoid skin breakdown. Gentle moisturizing is the appropriate approach to managing skin texture in lymphedema, not mechanical abrasion. Option 4. Apply a high pH lotion to the limb daily to keep the skin moisturized. While daily moisturizing is recommended for patients with lymphedema, the pH of the lotion matters significantly. The optimal pH level for the skin is slightly acidic, between 4.5 and 5.5, which acts as a defense against harmful bacteria and fungi. Using a high pH lotion disrupts this protective barrier, increasing the skin's susceptibility to microbial colonization and infection. This option contains an important nuance that separates students who understand the underlying physiology from those who are simply pattern matching. Daily moisturizing is correct. Dry, cracked skin is a significant infection risk in lymphedema, and keeping the skin supple and intact is a key self-management strategy. The recommendation is to use a pH-balanced or slightly acidic moisturizer, not a high pH product. The right behavior with the wrong product is still the wrong answer. When we apply our skin integrity principle across all 4 options, 3 of them either introduce heat that worsens swelling, create physical abrasions, or disrupt the skin's chemical defense barrier. Only option 2 directly protects skin integrity through safe, evidence-based nail care technique. The correct answer is option 2. Let's explore the all-student data. 74% of students selected option 2. Cut toenails straight across and file any sharp edges to prevent skin trauma. The correct response. 12% of students selected option 4. Apply a high pH lotion to the limb daily to keep the skin moisturized. 9% of students selected option 1. Soak the foot in hot water daily to soften the skin and improve circulation. 5% of students selected option 3. Use a pumice stone on areas of thickened skin to reduce buildup. This question is an other systems question which represents approximately 18% of all exam items. This question is an interventions question which represents approximately 26% of all exam items. This question is a level 2 question since the question requires students to integrate numerous pieces of information or to apply knowledge in a given clinical scenario. Remediation of level 2 questions occurs by increasing flexibility with academic content and by carefully analyzing decision-making processes when answering applied examination questions. Looking to review related academic content? Check out page 565 and page 566 in PT Exam, the Complete Study Guide. Thanks for joining us on the Score Builders Q&A podcast. See you next week.